As international medical graduates, we have heard about these concepts, but to be honest, sometimes we are not 100% sure what they mean. In some cases, we don't even have PAs or nurse practitioners in the health system where we came from or receive our training. So, in this video, I will dig into these concepts and the difference between them. Let me promote myself in a shameless way. If you like this type of content, subscribe to my channel. Also, I have Instagram, TikTok, Twitter, and more social media. You can check it out. I have the same username, and also I have the link all of my social media in the description box below. Let's jump to the video. What is a nurse practitioner? A nurse practitioner is someone who is a nurse that has a minimum of bachelor's degree, who has been educated at the master or doctoral, aka like PhD level, in a population focus. MDs, aka medical doctors, are fully licensed physicians who have complete medical school and resident training in a specific medical specialty. And physician assistant or PA are medical professionals training to diagnose and treat medical conditions under the supervision of physicians. Training and education. As international medical graduates, we have different type of system, different to United States. I know United States medical doctors need 5 years of pre-med, 4 years of medical school, and 3 up to 7 years of residence, plus 2 years of fellowship. I know in some places around the planet, you only need 7 years program, and we don't have a bachelor degree. You get into medical school and stay there for 7 years, and when you finish you are like a physician, a general physician, and after that you do your residency and fellowship. So it depends where you came from. PA education programs are typical 2 years up to 3 years graduate levels programs. Include both classroom and clinical rotations, at least of 2,000 hours of clinical rotation in a diverse range of settings. PA having a stronger emphasis on more primary acute care and emergency care. Nurse practitioner education programs are typically 2 years to 3 years graduate level programs. Most nurse practitioners require at least 500 hours of clinical practice under supervision, and this is in addition to usually around the 1,000 and something hours of clinical experience that's typically required to become a RN, which is registered nurse. Specialties. After completing PA school or nurse practitioner school, you are fully trained and able to join into the workforce. But ND is entirely different. After finish your medical school, you need a resident program training. You need to get into a resident program, and after you finish your resident, you are ready to go. Or if you want, you can get a fellowship. But to be honest, you don't need a fellowship to join the workforce as a medical doctor. However, you need a resident training. I know for international medical graduates, there are a couple of states having a special license where you can practice as a general physician. I have made a couple of videos related. I'm gonna leave the link in the description box below, so check it out. PAs, you can move between specialties. For example, if I want to work in pets and then a few years later go into emergency care, it's possible. However, nurse practitioner and MD programs, you do choose a focus. So whether that is adult critical care or maybe emergency care, you get training under that umbrella. It's not that easy to change a specialty in medicine, to be honest. If you choose family medicine and after a couple of years you want to move to, let's say, emergency care, you have to do your medical resident again. A scope of practice refers to what each type of professionals is expected and allowed to do. PA have a collaborative practice. Nurse practitioner have independent practice. This depends of the state, but let's say most of the state they have an independent practice. Depend what they do. And medical doctors, ND, independent practice. To recap, the biggest difference between nurse practitioner, medical doctors, and physician assistant lied in the education training, clinical hours of experience, and specialties and focus on.